Hi guys, Sarah Wilwert here. I am doing the joint movements video with the help of my daughter, Caitlin. The first movement is flexion. Flexion is a movement that decreases the joint angle, usually in the sagittal plane, as you can see as she lifts her leg there. Extension is a movement that straightens the joint and generally returns a body part to a zero position, as you can see when she straightens her leg there. The next is abduction, is the movement of a body part in the frontal plane away from the midline of the body, as you can see with her lifting her arm up there. Adduction is a movement in the frontal plane back toward the midline as she moves her arm back to the original position. Next, elevation is a movement that raises a body part vertically in the frontal plane, as you can see as she moves her shoulders up. Depression lowers a body part in the same plane as she returns her shoulders back to the original position. The next one is protraction, is anterior movement of a body part in the transverse horizontal plane. As you can see, she's moving her shoulders inward. And then retraction is the posterior movement, moving the shoulders all the way back as far as she can go. Circumduction, one end of appendage remains fairly stationary while the other end makes a circular motion. As you can see, she's rotating her wrist in a circular motion. Rotation applies to any bone turning around a fixed axis. Rotation is a movement in which a bone spins on its longitudinal axis. As you can see, she's rotating her head. Next is supination of the forearm, is a movement that turns the palm to face anteriorly or upward in an anatomical position. The forearm is supinated and the radius is parallel to the ulna. Pronation is the opposite movement, causing the palm to face posteriorly. As you can see, she moved her palm back down. All right, and the last and final ones here are dorsiflexion, is a movement in which the toes are elevated as one might do in applying nail polish. Plantar flexion is a movement of the foot so the toes point downward, as in when you're pressing the gas pedal for a car. All right, that's all I have for you guys. Thanks, Caitlin, for your help.